We've been working on this global position system during the last 7 years. And what's important is to build up a team structure when you have a cardiac arrest outside the hospital. So with this system, the system will GPS track the 9 geographically closest first responders in an area. And they will get a push message, which they can accept or reject. If they accept, they are still a part of the alarm. And the system will select the 3 most optimally placed first responders. Number 1, hurry to the place with the cardiac arrest to give the heart-lung resuscitation. Number 2, hurry to the nearest automatic external defibrillator, pick it up and take it to the emergency place to give the shock and restart the heart. And number 3 will hurry to the emergency place as a kind of on-site coordinator, taking care of the family and so on. So it's a kind of team structure which is increasing the survival from out of hospital cardiac arrest in rural areas, around the houses, and so on. This product originated because of the people on an island in the southern part of Denmark had paid for 100 automatic external defibrillators. And then we thought that people would survive a cardiac arrest, but nothing happened. So we need to make a kind of system to advise or call for these rescuers so that they will be on site to use the AEDs. The benefit with this system is that you can get a rescue team everywhere. If you're home, if you are in a rural area, if you're at the seaside, or you are in a big town, there will be a team to rescue when you have a cardiac arrest. And that will be the team of the people who are closest, geographically closest to the site with the cardiac arrest. I think in rural areas, people are lonely. So when we use this kind of digital health, we can also give them the help. It's not so easy in rural areas. They're lonely, but in bigger towns, there are many people around them. So what we know from Denmark, a lot of people survive cardiac arrest on public places, but most of the cardiac arrest happens around houses or in rural areas. So we have a lot of work to do, and I think the digital part of this will help us. Our GPS tracking system is working so that you advise these 9 geographically closest first responders. But at the same time, you also GPS track the local AED cabinet, so that the AED cabinet will turn on a blue flashlight, so that you can go for the blue flashlight when it's dark outside. So it's easy to find the automatic external defibrillator. There's also a siren sound, which you can go for if it's foggy weather. When we implement this system, we told the people who are volunteer first responders that they need to be trained. So they took at least a 12-hour course to learn how to give this first aid cardiopulmonary resuscitation. And every year they got a brush up. Our system GPS track the 9 geographically closest voluntary first responders. But at the same time, the system activates the automatic external defibrillator cabinets in the area, so that the people can go for the blue flashlight, and they can also go for the siren sound if it's foggy weather. And it makes it easier to find the AED cabinet when you are in a rural seaside area without street light and so on.